there is 2 to 3 core developments. The one is that we have to understand how to combine drugs we have already. So I believe that combination of BTK to BCL2 inhibitors like Ibrutinib to venetoclax is very promising, and I believe that this has to be brought to earlier treatment lines. The second development is the limited duration treatment with these combinations, because today we see an endless treatment in the relapse field, but I believe in the future we have the chance to use it in early treatment lines, and then indeed we need to limit that for the quality of living for our patients, not having these endless treatments with at least some side effects. The other point is, and the third point to me is that CAR T cells have to be placed best. And I believe there is 2 developments. The one is that we really have to address the high-risk patients, and we are eagerly working on that to establish a trial to explore CAR T cells in first line for high-risk patients. High risk is defined by either p53 alterations or a high MPC. So that is something we understand quite well now. And I believe for these patients who have a bad experience with standard regimens, this will really make a major improvement. Then I think we all wait for the SHINE trial, so chemo plus BTK, which would be very important. And if we look for biology and other drugs, I believe then there is a couple of drugs which are interesting. There is B-specific antibodies explored for the first time. Epcoritamab is one of the drugs I really would like to see, and I find them attractive for consolidation, for example, to induce MRD negative state. I believe there is antibody drug conjugates which are explored now in mantle cell lymphoma, and so I believe there is really a good development of novel approaches. And we have to do the proof of principle on the one hand, and on the other hand, we really have to make these drugs available as early as possible. And maybe by combining that in a clever and smart way, we really can convert it from an incurable to a curable disease.